Well, hello there, future nurses. Welcome to another episode of Med Monday, where I teach one medication in 5 minutes or less. Or I try to. I think last week's went over by a few minutes, but it was a pretty heavy medication. So real quick, before we get started, if you haven't already subscribed to the weekly Med Monday, where I send you the video and the weekly Med Monday fun sheet, remember that I have the link in the comments and I'll send that to you every week. So it's a great resource to use for studying and for clinicals. So let's go ahead and get started. This week's medication is methylprednisolone. So this medication, its functional class, it's a synthetic corticoid. Its chemical class is a glucocorticoid, and it can be given PO, IV, or IM. Now, it works by decreasing inflammation by suppression of the migration of polymorphonuclear leukocytes and fibroblasts, and it's used for the reversal of increased capillary permeability and lysosomal stabilization. Now, why do we give this medication? Well, we give it for severe inflammation, for shock, adrenal insufficiency, management of acute spinal cord injury, and multiple sclerosis. So, contraindications. Why aren't we going to give this medication? That includes hypersensitivity. So that, remember, is just any type of allergic response. We do not give it intraechial, and we do not give it to neonates. Now, we want to use it with precaution in pregnancy, with diabetes, glaucoma, renal disease, and peptic ulcers, and viral and fungal infections. So side effects, and these are non-life-threatening, include some mood changes and depression, fungal infections, poor wound healing, increased intraocular pressure, osteoporosis. So our adverse reactions or life-threatening reactions include thrombocytopenia, GI bleeding, thrombophlebitis, embolisms, and anaphylaxis. So that's full-blown allergic reaction. So nursing considerations are things that we should be looking out for and monitoring, would include monitoring our patient's mental status. We want to check our CBC, which is a complete blood count, our chemistry panel, and maybe a liver panel. We want to make sure that we're monitoring our patient's blood sugar because it can cause an increase in blood sugar. And let me go back to the CBC. It can elevate your patient's white count, so it's not always an indication of infection. Increased side effects with diuretics and amphotericin B. Little side note, we called amphotericin B amphoterrible because it is awful when we give it. And we want to monitor our vital signs, and we want to monitor our intake and output and for weight gain. And we want to monitor for adrenal insufficiency. So what are we going to be teaching our patient? Well, we want to make sure that they're taking this medication as prescribed, that it decreases the effect of anti-diabetic medications, specifically our oral medications. Do not take it with grapefruit because it potentiates, meaning it makes it stronger. Do not discontinue this abruptly because it can cause adrenal crisis. We want to teach them signs and symptoms of adverse reactions, specifically about adrenal crisis. And I think in the email teaching this week, I touched on the adrenal crisis. And we want to monitor for infection. And we want to make sure that they increase their intake of potassium and calcium. And to avoid alcohol. That's not any fun. And we want to make sure that they check with their doctor or a pharmacist before taking herbal supplements and over-the-counter medications because it can interact. So our challenge question for the week. Your patient is 32 years old and he is admitted for acute spinal cord injury. He weighs 164 pounds. The PA orders methylprednisolone infusion of 30 milligrams per kilogram in 50 mLs NS to infuse over 15 minutes. How many mLs per hour will you program the pump for? And that's it. So thanks for joining me this week. I hope you guys are enjoying this. Make sure to subscribe so you get all the information sent to you every week. I hope you have a great week and keep working on your dreams.